The sound of crashing vehicles had barely faded when ambulance nurse Sharon Carter noticed her patient's pulse weakening. Ambulance driver Mike Thompson was stuck in the middle of a chain reaction accident on Interstate 75. "Sharon, we can't make it to the hospital," Mike said anxiously. "It'll take at least 45 minutes to get out of this traffic." Sharon looked at her patient. 52-year-old David Johnson had suffered a heart attack, and his condition was rapidly deteriorating. In the back of the ambulance with limited equipment, unable to reach the hospital, lay a patient in mortal danger. "Pull the ambulance over," Sharon said, her voice different than usual, authoritative, determined. "Sharon, what can we do here?" Mike asked in confusion. But Sharon was already starting to move because this situation wasn't foreign to her, and in the next 25 minutes, everyone on Interstate 75 would learn who Sharon Carter really was. Because some people wear nursing uniforms, but never stay passive. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments what city you're watching from and hit that subscribe button. Sharon Carter was Denver Metropolitan Emergency Services' most reliable ambulance nurse. At 32 years old, she had been working at the same institution for 4 years. She never made mistakes during her shifts, kept patient records meticulously, and maintained her composure even when facing the most challenging situations. Sharon, whose light brown hair was always neatly pulled back in a bun, inspired confidence in patients with her warm approach, and her gentle tone of voice put them at ease. Her green eyes quickly analyzed every situation, and the steadiness of her hands gave patients confidence. Sharon's work team consisted of ambulance driver Mike Thompson and medical technician Lisa Adams. Mike was a 38-year-old experienced professional who knew the intricacies of ambulance driving with 6 years of experience. Lisa was a 29-year-old talented technician who had been working at Denver EMS for 4 years. Sharon's medical approach was far beyond standard ambulance nursing. During emergencies, while others applied routine protocols, she could make much more comprehensive assessments. "How do you know such detailed examination techniques?" they would ask. "Experience," Sharon would say briefly. Sharon's equipment control approach was markedly different from her colleagues. She would inspect every piece with military precision, reviewing rescue equipment and medical instruments, as if preparing for a critical operation. "We're just ambulance nurses, Sharon, not elite units," they would joke. Sharon Carter had joined the Army at 18 years old. In her youth, she had lost most of her family in a house fire. Her 14-year-old sister, Emma, had died because rescue teams arrived too late. That night, she had made a promise to herself. "I will get the best battlefield medical training." When she joined the Army, she had focused on the combat medic program. After basic military training, she was selected for advanced level programs. Army Special Operations Medic Course, a 20-month intensive training program, medical intervention in combat conditions, life-saving with limited resources, surgical operations under fire. Sharon had ranked in the top 3%. "A combat medic is not just a healthcare worker," said Training Commander Major Williams. "You are the person who makes life and death medical decisions. Even under enemy fire, you will keep wounded soldiers alive." The most challenging part of her training was medical operations in combat zones, rescuing wounded under enemy fire, performing surgical procedures with basic tools. Sharon had developed extraordinary abilities in these areas. In her first deployment, she was with the Forward Operating Base medical team in Afghanistan. Medical operations in combat zones, treating wounded soldiers after bomb attacks. Sharon's most critical success was saving a lieutenant who was severely wounded by a mine explosion. In her second deployment, she was with the Urban Combat Medical Support Unit in Iraq. Medical aid in urban warfare, emergency interventions after guerrilla attacks. The techniques she learned during these deployments were methods never used in civilian life. Her third deployment was Peace Force medical operations in the Middle East. Civilian medical aid in conflict zones, medical support to families affected by war. Sharon had now gained medical expert-level competency in all types of geographical and political conditions. Over 10 years, Sharon had successfully completed 142 critical medical operations. So why had she left the Army to become an ambulance nurse? This story was more complex. PTSD, adjustment problems, civilian life challenges. Sharon's transition had not been smooth. High-stress medical work felt familiar, but civilian procedures were different. And this tension would explode today. After receiving an honorable discharge in 2020, Sharon had transitioned to civilian emergency medicine. She had received PTSD treatment, adjustment counseling, and career transition support. Ambulance nursing had been an ideal match. When Denver Metropolitan Emergency Services hired her, Sharon was overqualified. Nursing degree, 10 years of military medical experience, combat medic certification. But the hiring committee didn't ask detailed questions. "I've always loved helping people heal," Sharon had said. And this time she was completely sincere. Daily work was easy compared to combat medicine, patient transport, basic medical care, routine calls. But Sharon was doing much more. She evaluated every case from a combat medic perspective. "Sharon, how do you know emergency medicine management so well?" colleague Lisa would say. "Observation," Sharon would say. "Every emergency situation is instructive." This observation came from 10 years of battlefield experience. That Wednesday afternoon when she started her shift, 52-year-old David Johnson had suffered a heart attack and needed urgent hospital transport. Sharon, Mike, and Lisa were about to complete a routine cardiac emergency call when they realized David Johnson's condition was critical. "This patient requires immediate transport," Sharon had said. "Let's take the fastest route to the hospital." Sharon, Mike, and Lisa were carrying out the emergency hospital transport of the middle-aged man who had been stabilized after cardiac arrest. David's condition was delicate and required constant monitoring. While trying to get David Johnson to the hospital, they unexpectedly encountered a chain reaction traffic accident on Interstate 75. Mike was driving at normal speed while Lisa monitored David's vital signs. "It's going to take time to get out of this traffic jam," Lisa said anxiously. Sharon looked out the side window and noticed a major accident ahead of them. On Highway 75, just a few hundred meters ahead, an 8-vehicle chain collision had occurred and traffic had come to a complete stop. "We're stuck in traffic because of the accident," Sharon said. "David's condition is stable, but we need to continue monitoring." Mike had to stop the ambulance. Sharon automatically put her body into high alert mode, and just then, David Johnson's condition became critical inside the ambulance. As they approached the accident scene on Interstate 75, David Johnson's condition suddenly deteriorated in the back of the ambulance. The cardiac monitoring systems began sounding alarms. "Sharon!" Lisa screamed. "David's heart has gone into arrhythmia." Sharon looked at her patient. 52-year-old David Johnson's vital signs were rapidly declining. His heart rhythm had become irregular. His blood pressure had dropped to critical levels. "Mike, pull the ambulance over," Sharon said with an authoritative voice. "Now!" "Sharon, this is the middle of the interstate," Mike panicked. "The hospital is 15 minutes away." "David doesn't have 15 minutes," Sharon replied clearly. "He has 5 minutes." Sharon approached David and quickly performed a vital signs assessment. Pulse, weak and irregular, breathing shallow, blood pressure 70/40. Cardiogenic shock was developing. "Sharon, this requires advanced cardiac life support," Lisa said anxiously. "This is beyond our paramedic scope." Sharon didn't hesitate. She pulled out special medical equipment from the ambulance. These materials weren't standard ambulance equipment, advanced life support tools designed for combat medics. Lisa had never seen this equipment before. "Sharon, where is this coming from?" "It was always there," Sharon said. "We just never needed it before." Sharon activated her 10 years of combat medic training, advanced cardiac life support, IV medication administration, cardiac rhythm management. Every movement was performed with precision perfected in dozens of battlefields. "Lisa, prepare the cardiac medication kit. Mike, get the manual ventilation bag," Sharon's voice was now commanding. David's heart stopped again. "Cardiac arrest," Lisa shouted. Sharon immediately began CPR. But this wasn't normal CPR. This was military-grade resuscitation protocol. The technique she had learned on battlefields to bring life back in impossible cases. On the side of the interstate, amid traffic noise, Sharon was fighting for David Johnson's life. For 15 minutes, she performed continuous chest compressions. Sweat was pouring, but she didn't stop. Advanced medication protocols, electrical cardiac stimulation, specialized resuscitation techniques. Every second was critical. David's life was slipping away under her hands. "Sharon, 15 minutes is too long," Lisa was crying. "Maybe we should—" "Never!" Sharon's voice echoed across the interstate. "I won't lose David. Combat medic oath, never give up, maximum effort, fight until resources are exhausted." Sharon's hands were like a machine, rhythmic, powerful, determined. 10 years of combat experience had been accumulated for this moment. 20 minutes, 22 minutes. Mike and Lisa had lost hope, and at the 25th minute, thump. David's heart began beating. Incredible. Lisa fell to her knees. How did you do it? Sharon was breathing heavily, but her eyes were shining with victory. "Because I never give up." Just then, highway patrol and emergency response teams arrived. The interstate accident was under control. Emergency medical supervisor Captain Roberts approached Sharon. "Ma'am, may I get your medical response report?" "One patient, cardiac arrest, prolonged resuscitation, successful return of spontaneous circulation after 25 minutes. Captain Roberts reviewed the reports. "This is incredibly advanced cardiac care. Who provided this level of care?" Lisa looked at Sharon. "Sharon did it, by herself." "Ma'am, how do you know these advanced procedures?" Sharon decided to end 4 years of secrecy. Staff Sergeant Sharon Carter, U.S. Army combat medic, retired. Silence. Captain Roberts' mouth fell open. "Army combat medic?" 10 years active duty. Special Operations Combat Medic Training, 3 deployments. Lisa's eyes widened. "Sharon, you were a Special Forces medical specialist," Mike asked in amazement. "Why did you never tell us?" "Because past experience should stay in the current position," Sharon said. "I'm an ambulance nurse now." At Denver Metropolitan Emergency Services headquarters, Operations Director Martinez began reviewing the cases. "Who handled the interstate cardiac emergency?" "Our ambulance team," Lisa said. Martinez looked at the medical reports and was shocked. "This is extraordinary. Prolonged cardiac resuscitation, advanced medication protocols, successful revival after 25 minutes. This is expert-level medical care." Sharon was quietly cleaning equipment, but Martinez's next question would reveal everything. "Which one of you provided this quality of medical care?" Lisa looked at Sharon, and Sharon decided to tell the truth. "I performed it, sir." "This is combat medic level care. Where did you receive your training?" Sharon took a deep breath. U.S. Army Special Operations Combat Medic Program, Advanced Cardiac Life Support Specialist, 3 deployment periods. Complete silence, and at that moment, everything made sense. Martinez was amazed. "Our ambulance nurse is a retired Special Operations Combat Medic?" "Not just combat medic. Advanced cardiac life support, prolonged resuscitation, critical care transport specialist." Lisa and Mike, along with now fully recovered David, understood, but the real shock hadn't come yet. "What was your military rank?" "Staff Sergeant, Combat Medical Specialist." Even Martinez was impressed. "Staff Sergeant, in terms of medical experience, you surpass many of our specialists." Sharon was humble. "Different context, sir. I'm an ambulance nurse now." But Martinez's next offer would change Sharon's life. "Staff Sergeant Carter, would you consider joining our critical care transport program?" Sharon was surprised. "I don't have civilian advanced certification." "We can arrange that. Your experience, your skills, we need them." Sharon's story isn't just a heroism story. It's also about medical expertise, finding meaning in civilian life, the spirit of service, and never giving up. Because sometimes the most skilled medics work as nurses in ambulances, saving lives even on interstates. People Sharon saved say this when they see her. Real heroes overcome traffic noise. The courage Sharon showed that day on Interstate 75 didn't just come from medical training. It came from her determination to protect people from extreme situations in civilian life. "I'm no longer a soldier," Sharon would say. "I'm a healer, and no traffic situation will cause me to lose people. Real heroes change their uniforms, but their life-saving missions never end. If this story moved you, share it, subscribe, and help these important stories continue. See you in the next legend. And remember, your emergency medical worker might have the ability to overcome extreme situations you'll never know about. Service never ends. It just overcomes traffic.